Good afternoon, everyone. Welcome to today's webinar. My name is Tom Hunter-Pratt. I'm the Multimedia Specialist for the Institute of Child Nutrition. I'm going to allow everyone a few seconds to come into today's webinar. It takes a moment for everyone to come in. I'm going to give a few announcements while we're waiting. You all are in listen-only mode as you join today, so everyone will be muted by default. And at the end of today's webinar, you all will see a pop-up screen. It's going to be a Zoom pop-up screen. It's going to ask you to go and take a survey. It's going to show you a SurveyMonkey link. It's going to ask you to click continue to go to the survey. We would ask that you all wait till the end of the webinar, and as you see that pop up, please click continue for us. We would like to get your feedback. We value your feedback, and we would like to get that from you. So if you see that pop up, or when you see it at the end of the webinar, go ahead and click continue. That will redirect you directly to the survey. Also, within 24 hours of today's webinar conclusion, you will receive a follow-up email that also contains a recording of today's webinar, as well as the same survey. So if for some reason the survey pop-up doesn't work for you, you will also get a link to that in the follow-up email. Within 24 hours of the conclusion of today's webinar, I will also be sending out a certificate, so look for that as well. I'll send that out within 24 hours of the end of today's webinar, and you'll get that in your email. Thank you all for joining us today. I'm going to turn it over to Janae.
Thank you, Tom Hunter. All right, welcome everyone to the ICN September STAR webinar done in conjunction with the USDA Office of Food Safety in celebration of National Food Safety Month. Today's webinar will highlight a bird's eye view of your food safety plan from beginning to end as we aim to mitigate risk throughout the flow of food from purchasing to serving to transporting and traceability. During today's webinar, all attendees are muted. There will be time for questions following each speaker's presentation. If you have a question, please type it into the question box on your screen. We will try to get to as many questions as possible, but due to our time constraints, every question may not get answered during the webinar. Any available handouts can be downloaded directly from the webinars panel, but I believe we don't have any webinars for today's webinar. Individuals who are registered for the webinar will receive an email at the conclusion. The email contains the webinar recording link and a link to the evaluation survey. Please complete the evaluation survey, and ICN will send out the certificates within 24 hours. To assist in meeting the unique training, technical assistance, and professional development needs of school nutrition professionals, ICN has launched the School Nutrition STAR, which stands for Strategies, Trainings, Action Plans, and Resources initiative to assist school nutrition professionals develop goals and best practices to improve program administration and operations. The School Nutrition STAR program offers a magnitude of elements, including face-to-face workshops, virtual instructor-led trainings, webinars, and spotlight success stories. ICN collaborates with USDA to host monthly STAR webinars to provide attendees with training, real-life strategies of program implementation, and best practices for use in action plans and/or goals. Training topics, free resources, and educational materials are also highlighted to assist school nutrition professionals with navigating through the enhanced responsibility of school nutrition operations. The Institute has created a website for all materials and resources specifically related to the webinars. You can find this information at www.theicn.org/star. And thank you so much for joining today's webinar on food safety from the beginning to end. Follow the flow of food. So the USDA professional standards for this webinar falls under key areas operations. The topic meets the USDA Professional Standards Code 2000. Joining us for our webinar today is first Lauren McLean. She is a food safety specialist in the Office of Food Safety within the Food and Nutrition Service of the U.S. Department of Agriculture. Lauren obtained a bachelor's degree in biology at Temple University and has 7 years of experience in food safety, environmental health, and public health. During Lauren's time with the Department of Public Health in the city of Philadelphia, her duties included providing training, conducting various regulatory activities throughout the jurisdiction, supervising environmental health and food safety staff and activities, and serving as the primary emergency responder for the city during on-call hours. In her current role, Lauren contributes to the Office of Food Safety's mission, which is to protect people served by FNS programs from foodborne illness by developing food safety education, training, and technical assistant resources to support child nutrition program operators. This work is done through the incorporation of science-based food safety research and knowledge, as well as collaboration with external food safety partners. Also, Lauren is having some technical difficulties today, so if we lose Lauren, Tina Haynes will join us in place of her, but we hope Lauren will be with us for the whole time today. Okay, and our second panelist is Cindy Story. Cindy has been a member of the USDA Produce Safety University teaching team since its inaugural year in 2010. Cindy is a registered dietitian and certified chef with a PhD in food and lodging management. She and her K-12 culinary team work together to bring their skills and experience in developing a culinary systems approach to enhance school nutrition operations. The team has a combined skill set that includes food safety, culinary arts, nutrition, kitchen operations, recipe development, and adult education programs. The White House recognized Chef Cindy with the Champion of Change Award in 2011, and she received the 2018 Academy of Nutrition and Dietetics School Nutrition Services DPG Award of Excellence. And also, Tina Haynes is with the Office of Food Safety. Okay, and our objectives for today will include, or we will be identifying common foodborne pathogens associated with retail operations, such as schools. And this quick overview will lead into our focal topics, which include preventing foodborne illnesses by practicing good personal hygiene, controlling time and temperature, as well as eliminating opportunities for cross-contamination. And we will also discuss safe transporting and documenting procedures to ensure traceability in the event of a food recall. Finally, we will circle back to some of the questions asked in previous webinars to provide more information and clarity. All right, and now I will turn the presentation over to Lauren.
Thank you, Janae. First, we're going to start with food safety hazards. Food safety workshops usually present all three foodborne illness hazards. These include biological, chemical, and physical. While all are important to prevent or control, today we're going to zero in on the most common source of foodborne illness, which is biological contamination. Next slide. Bacteria, viruses, and parasites have been associated with foodborne outbreaks in school. Of these three, there are more illnesses associated with viruses. Why, you may ask? Well, because norovirus is the leading cause of foodborne illnesses, and schools, like cruise ships, are closed environments with lots of people and many surfaces for the virus to easily pass from person to person. Viruses do not multiply like bacteria living in your body. They need a host to survive, and you, unfortunately, are the perfect host. Next slide. It should come as no surprise that this bug is very resistant and can survive in your freezer in temperatures as high as 140 degrees Fahrenheit and for up to a week on stainless steel surfaces. It takes an extremely high concentration of chemical sanitizer, such as a chlorine solution at 1,000 parts per million, to destroy this pathogen. You cannot use your regular sanitizer solution from your pot and pan sink to destroy this virus. For more information and training, the ICN has an entire section on their website devoted to norovirus. So go ahead, take a minute after this webinar to take a look. We suggest you include norovirus in your annual food safety workshops, even if your custodial staff are the ones trained to clean and sanitize. School nutrition personnel should still be aware. Next slide. So in terms of bacteria foodborne pathogens, these include Salmonella, all serotypes, E. coli, O15787, C. perfringens, Staphylococcus aureus, and Shigella. Bacteria may also be a major source of a foodborne illness outbreak. Of these listed, Salmonella, aka Sam and Ella, is the #1 cause of over 1 million infections every year, and sadly over 400 deaths based on the CDC statistics. It is always surprising to me to read about an outbreak in a food that I never would have previously thought was a concern. Just last month, you may have read about Salmonella enteritidis linked to bags of fresh peaches. Thankfully, no deaths have been reported. Shortly, we will travel through your kitchen discussing the flow of food and how monitoring time and temperature and practicing good personal hygiene while preventing cross-contamination are critical to controlling the spread and growth of these pathogens. Next slide. The risk of a parasitic infection is not as common in schools, but it's still possible. Just this summer, there was a recall that you may have heard about issued for bagged garden salad due to a potential contamination with a parasite called Cyclospora. The scariest part is that you may not know you have been infected. People may live with diarrhea and weight loss for months before being diagnosed. Now, the weight loss part may sound good to some of you, but trust me, this is not a safe diet plan. Although somewhere on the internet next to the cabbage soup diet is probably the parasitic quick trim diet. I don't recommend you try that at home. The bottom line is that biological, physical, and chemical contaminations can occur, so it's up to us as school nutrition professionals to implement HACCP-based food safety plans from beginning to end to safeguard our customers from foodborne illness. Next, let us follow the flow of food and highlight where along our chain of custody we can reduce or eliminate these hazards by practicing good personal hygiene, controlling time and temperature, and preventing cross-contamination. Next slide. Purchasing food. I'm now going to turn it over to Chef Cindy.
Thank you, Lauren. Could you all hear me? Tom? Okay, we're good to go. Okay. I can't hear you guys on my end, but you guys can hear me, and that's all that matters. Thank you, Lauren, for that information. Boy, that sure took me back to studying for that ServSafe exam. I don't know about you all. Before we can get into managing food safety in our operations, we must first, as it says on the slide, buy from a reputable supplier, because it may not be possible to make a product safer later. That's why you have to do your due diligence in advance. So a reputable supplier is one that is doing everything possible to make sure that no one gets sick or hurt. So a reputable supplier will, one, not have any issues providing you with a letter of food safety assurance. Two, allow you to review documentation of their food safety plan. And three, allow you to periodically visit their facility for a tour. Okay, here's the bottom line. If a vendor does not want you to come and visit, okay, that's not going to be a good sign. All right, next slide. Receiving food. So now let's get into your operation. When you receive food from vendors, they are handing over the chain of custody, meaning the responsibility to you. So this is control step number one. The first thing you want to do is get ready to receive. Now, it's not like it's going to be a surprise. You know the day of delivery, so get ready for it. Organize your space in your storage areas. Create an easy path to the kitchen. You know, don't put carts and racks near the entrance that you have to then move out of the way when the doorbell rings. Next, during delivery, take temperatures of a sample of refrigerated foods and record safe holding temperatures either on a receiving log, or you can just record it right on your invoice. Inspect frozen foods to make sure they are still frozen. Inspect dry goods for things like dented cans, leaks, or any kind of spillage. And you know, we are hearing more and more school districts accepting drop deliveries at 4 or 5 a.m. Before the staff arrive for the day. So you may ask the question, so how do we document safe temperatures in this situation? We recommend that you create a vendor log for the delivery person to then record the time, record the product name, and the product temperature. Then, the first person to arrive at work is going to take and record the product temperature on another column on that same log. Now, yes, okay, the driver could falsify the report, but most likely you're going to be checking about 1 to 2 hours later. So if the driver records 38 degrees and you check 2 hours later and the product is 42, okay, then you know you should investigate this situation. But first make sure that your refrigeration equipment is in good working order. Anytime you have an issue with a vendor, be sure that you're filling out the vendor complaint form, because remember, if it's not documented, it's not done. All right, next slide. Storing food. So the next control point in our flow of food is storage. Most kitchens store dry, frozen, and refrigerated foods. The refrigerated TCS foods are of most concern here because they are the ones that are held very closely to the temperature danger zone. Now, some of you may know this. It is pretty widely accepted that to hold foods at 41, your air temperature must be 39 degrees. And if you're ever concerned about your air temperature, then take the temperature of the food, because that's where the concern is. Also be sure that your ambient air thermometer is stored nearest the door. Okay? Do not trust the one on the unit. Now you may ask, why nearest the door? That is because that's your warmest location. So if the temperature at the warmest near the door is safe, then the rest of the unit should be safe too. Also know that some of you may have those continuous monitoring systems. These are great. They message someone that the equipment is now in unsafe temperature territory before it's too late. But if you don't have these monitoring systems, we recommend that you check your equipment when you first arrive to work and then again at the end of the day. So you have 2 opportunities for corrective action. All right, next slide. Overall, I think our school nutrition staff does a very good job preventing cross-contamination in storage areas, and this is probably due to our annual food safety training and site managers taking food safety certification courses such as ServSafe that I just mentioned. Now take a look at the photo on this slide. We are all very familiar with this chart aimed at preventing cross-contamination in a refrigerator. So from raw poultry on the bottom to ready-to-eat foods on the top. To me, a simple way to remember this is to think about those final cooking temperatures from highest to lowest. So you start on the bottom shelf and you're going to work your way up. Raw poultry, eggs, 165, then ground beef at 155, your whole cuts of meat, 145, pre-cooked foods coming from the manufacturer and your vegetables, 135 degrees. And then finally on the very top, you're going to have your ready-to-eat foods, which may be consumed in some cases cold. And be sure to leave room for air to properly circulate in your refrigerator. If you cram it in and overfill the unit, that's going to limit air circulation. That's going to then lead to uneven temperature distribution, especially in all those reach-in units. So what do we want to remember here? Don't pack your refrigerators and freezers all the way to the brim. Leave some air gaps to facilitate that airflow. All right, next slide, preparing food. So I just bragged on you, okay? Now I have to point out an area that really needs improvement, and that's preparing foods. So for years and years and years, our tradition was to organize your mise en place in advance, pull out everything that you need. Well, thankfully, we know today that it is much safer to prepare food in batches. For example, if you're making deli turkey sandwiches or you're cutting up fresh melon, you want to keep these TCS foods under refrigeration just as much as possible. You might have a cantaloupe that's been contaminated with salmonella that Lauren mentioned, but by keeping that melon under 41 degrees, you're going to keep the growth of that bacteria way below unsafe levels. Another key to safety when preparing foods is good personal hygiene and preventing cross-contamination. So this is going to include washing your hands for 20 seconds now. We're going to scrub for 20. Proper glove use, using food contact surfaces that have been cleaned and sanitized. Earlier, Lauren mentioned that viruses are the #1 cause of foodborne illness. Well, guess what? Okay. Hand washing is the #1 prevention for the spread of these pathogens. So hopefully COVID-19 has improved our hand washing and glove use practices. I think someone needs to do a study after this pandemic is over. Okay, next slide. Cooking food. So we've already mentioned the required final internal cooking temperatures back when we were talking about storing foods. So let's just take a moment here again to say, if it's not documented, it's not done. You have to record that final cooking temperature on a log or use a system that records the temperature and saves it on your computer. Because if you are ever in a foodborne illness lawsuit, you have to show that you've done everything to make sure that those foods were handled safely. And these logs demonstrate what we call reasonable care defense. Okay? Basically, it's just your due diligence in preventing foodborne illness. In addition, we recommend that each kitchen be equipped with at least one of the thin tip digital thermometers for thin foods. You know, it's very difficult to take temperatures of thin foods with a bimetallic stem thermometer. I know you can stack it and all of that, but you know, we have a lot of thin foods, so that's a great piece of equipment. All right, next slide. Holding food. I would have to say this is another area that needs improvement, and frankly, it's a simple fix. Okay, stop preparing and cooking foods at 8:30 a.m. to then be served at 11 a.m. I'm sure if we did a polling question right now to ask how many of you have seen the warmers filled to capacity for lunch at least 2 to 3 hours before service, the majority of you would say yes. So for food safety and peak quality, start batch cooking, reduce those holding times. You're down to 45 minutes to 1 hour, no more than 20 to 30 minutes for vegetables and other foods that you know don't hold up well in the warmer. And lastly, be sure to use thermometers designed for a warmer. Your oven thermometers start at 200 degrees, and that's way above recommended holding temperatures. At 200, you're cooking the food again. All right, next slide. Serving. So the 3 keys to food safety come together once again at the serving line. And you all know the temperature rule. Hot food's hot, cold food's cold. And I can tell you from experience, okay, it is much easier to keep hot foods hot than it is to keep cold foods cold. So we recommend that you only put out enough cold TCS food items, for each lunch period, or if you're transporting, keep them cold in the refrigerator as long as possible. Now, let us mention here that we are talking about TCS foods such as deli sandwiches, all of your dairy products, and 3 produce items. Okay, I'd ask you what they were, and I'm sure you could tell me. Cut melons, sliced tomatoes, and 22 different types of leafy greens. Now, you might want your canned peaches to be chilled, and listen, that is up to you. But canned fruits are not a TCS food, so if the temperature rises to 45, we're not seeing that as a food safety hazard. Now, good personal hygiene is frankly a win-win. Yes, the customer is protected, but it's also, think about it, good customer service. And your students are very well aware this day and time of poor personal hygiene, so it could impact your participation. And finally, we have not mentioned the 4th key to food safety as we've been going through the flow of food today, but it would be allergen control. Make sure you're avoiding cross contact during preparation and service of foods. We don't reuse parchment paper or share serving utensils between foods because frankly, it could be deadly to someone. All right, next slide. USDA Office of Food Safety is proud to say that the Kansas State University's Center for Food Safety and Child Nutrition Programs has conducted a lot of research on cooling foods safely. And I would have to say, this is another area that needs improvement, in my opinion, in many schools. We're just so rushed at the end of the day that we may not take care to follow that 2-stage cooling rule. requiring that your hot foods get to at least, oh, I heard you, 70 degrees before placing it in the refrigerator. But we have several suggestions to help you today. 1, batch cook to reduce leftovers. 2, go ahead and transfer your food to a sheet pan or a 2-inch shallow pan. Notice I said 2 inches a shallow pan to start the cooling process. 3, you can place the food in a freezer, or if you're a lucky one, a blast chiller to go ahead and start cooling to 70. And then at 70, we would transfer from the freezer into the refrigerator to get it down to 41. And lastly, place the food in some type of leak-proof container inside an ice bath, and then you can place that in the refrigerator to cool. Now, frankly, I am I'm a big fan of batch cooking, not only to improve quality and safety, but also to control excessive leftovers. You have really 3 choices for handling hot leftovers: save it, reuse it, or toss it. So this simply means you can cool it properly, okay, following 2-stage cooling, and then you can freeze it for the next menu cycle. Or you can cool and use in another menu item later in the week, or you can discard the food. Now notice I said cool and use in another menu item later in the week. Personally, I'm not a fan of offering the item at the first lunch the following day to, oh, we're gonna just offer that as an extra item, we're gonna get rid of that. So yes, you've saved it, but the problem is this method is going to always skew your forecast. You're never going to know how much to prepare if you do this. All right, I'm going to now turn the presentation back over to Lauren to talk more about transporting and traceability.
Thank you, Chef Cindy. That was some great information. The next step that you all need to keep in mind is transporting food. There are 2 methods for transporting hot and cold food safely. Using temperature control, which means simply keeping hot foods hot and cold foods cold, just like Chef Cindy said, or using time to control food safety. To use time as a public health control, you must record the time and temperature of the food when it's removed from hot or cold holding, and also the time that the food is consumed or discarded. If hot foods are stored below 135 degrees Fahrenheit, they must be used within 4 hours. On the other hand, if cold foods are stored above 41 degrees Fahrenheit, they must be used within 6 hours as long as the food temperature does not exceed 70 degrees Fahrenheit. Remember, if you are not monitoring the cold food temperatures to ensure the food does not exceed 70 degrees, then you should stick to the 4-hour rule. Also, please check with your state or local health authority for more information, since some states, such as California, only allow cold holding for 4 hours without temperature control. Remember, the time the food is removed from temperature control, as well as consumed and discarded, must be recorded on your log. Next slide. So in terms of delivery and pickup meal service, schools are doing their very best to reach customers wherever they may be by providing meals for virtual students. Yes, we can do virtually everything. For menu planners, this will require thinking through logistics and food safety procedures. A hot food may be delivered or picked up for consumption that same day using time and temperature controls. This is also known as time as a public health control, or TPHC. You can also provide a frozen or cold meal to be eaten the next day. Another option is multiple frozen or cold meals may be delivered or picked up for the whole week. In either case, food for consumption at a later time should include a label for handling it safely, just as labels are required by the FDA and health departments for other retail outlets like grocery stores or convenience stores. Hot and cold meals using TPHC must be labeled with consume or refrigerate within 4 hours or discard. Next slide. So here we have safe handling instructions. These apply to frozen and chilled food item labeling, just like you would with your groceries. These include refrigerate immediately, or a use by date, which is typically 3 to 4 days, even though this may vary in some jurisdictions, or heating instructions. Next slide. For hot food, on the other hand, this is handled just like takeout. You should consume within 2 hours or refrigerate immediately and use by a certain date, which is typically 3 to 4 days, unless it varies in your jurisdiction, or reheat hot leftovers to 165 degrees Fahrenheit. And as Chef Cindy mentioned, you can use your thermometer to check the internal temperature to make sure you reach it. Next slide. In terms of food traceability, school meal operators probably feel like they have gotten into the catering business during this pandemic. Foods are being prepared and sent to classrooms, picked up at the curbside, or delivered to people's homes. With all of these new food systems, we thought it would be a good idea to share some of the best practices for transporting and tracing foods in the event of a recall, just like farmers and food distributors would have to. Next slide. Central kitchen operators are used to tracking foods that are prepared, then transported for service at the site level. Staff in receiving or satellite kitchens that are transformed temporarily into a central production facility may or may not realize how critical it is to maintain the chain of custody in the event of a recall or a foodborne illness outbreak. Next slide. Here are some options. You can use a simple batch number-based system to track meals that are prepared and shipped to other sites. For example, use the week number, day number, preparation kitchen ID, and receiving kitchen ID. And you can combine these to create a batch number. Bundles of packaged meals would then be labeled with this numbering system for traceability. The receiving site will retain the label in the event of a recall or another reason for tracing and documentation. At the preparation kitchen, on the other hand, the production record will be used to record the detailed meal component information along with the batch ID. Next slide. Another very simple alternative is to use today's date. How easy is that? You can see an example on the slide. Next slide. In the unlikely event that a school district needs to notify parents, the school that distributed the meal should be prepared to email and or call meal recipients immediately to provide handling and disposing instructions. Next slide. We hope that you've enjoyed today's webinar. Let's summarize the key takeaways. Microorganisms are everywhere in our environment, both good and bad, or helpful and harmful. The purpose of your HACCP-based food safety plan is to identify areas from purchasing all the way to serving where hazards can be controlled, reduced, or eliminated, and that includes time and temperature control, practicing good personal hygiene, as well as preventing cross-contamination. While bacteria and viruses are of the most concern, remember that physical and chemical contamination can cause harm as well. Finally, you are in charge of the food while it's in your custody. Please remember that. If you transport food, you must think like a manufacturer. Where has the food been and where is it going? We refer this to as one step forward and one step back tracing. And remember, it can be as simple as adding today's date. Now, before we move on, we have a poll question that we would like you to answer. Next slide. Please take a minute to answer our poll. After this webinar, we will have a survey which you can use to share your thoughts regarding the challenges that you may have experienced and changes that are in place to accommodate students who have special dietary needs like allergies. Changes that may be in place include extra labeling and instructions, providing information for a central point of contact for special dietary requests and needs. We would love to hear more information, so please take the time to fill out the survey after this webinar. And we will give you another minute just to get your answers in. Once again, the question is, are you encountering any challenges with accommodated students with special dietary needs, like allergies, during the various types of meal service? This includes pickup, classroom, or delivery. And the answers are yes or no. Once you answer this question, you will have the opportunity to share your thoughts. So we have our answers. 29% said yes, they are encountering challenges, and 71% said no. So thank you for taking the time to vote. Next slide. So now we're going to get into some of the frequently asked questions that we received from previous webinars. The first topic is using face shields. Many people ask, can face shields be used instead of masks or coverings? The CDC recommends that people wear masks or face coverings in public settings and around people who do not live in your household, especially when physical distancing may not be maintained at all times. A face shield is primarily used for eye protection for the person that wears it. The CDC does not currently recommend the use of face shields as a substitute for masks. There's not enough evidence to support the level of protection or the effectiveness of face shields for source control and as a barrier against the spray of those COVID-19 respiratory droplets from the person who may be wearing the face shield. Therefore, the answer is face shields are not a substitute for wearing masks. Masks are the most important part of protection and is one of the most important protective measures against COVID-19. The next question we received is do face masks or coverings need to be worn in the kitchen if you are not within 6 feet of another person or employee, or if you're alone? As I said, masks are a critical preventive measure, and they're most essential in times when it's not possible to physically distance or social distance. In settings like designated work areas, which may be an individual office or a kitchen with nobody else, when you will definitely be alone and you will continue to be for that shift or time period, then you do not need to wear a mask. It's not necessary because there's nobody else around you. However, if there's any chance that another person or employee will enter that work area or space at any time, then you should wear your mask. The next great question we received is, should a chemical spray bottle or a normal sanitizing bucket be used to wipe down surfaces, or should I use both? Well, both chemical spray bottles and sanitizer buckets can be used to clean and wipe surfaces. It is important to check that the appropriate concentration of sanitizer is present in both the bottle and the bucket before using it and applying it on the surfaces. Since wiping cloths may need to be dipped in the sanitizer solution before using it on a different surface, the sanitizer bucket may be more practical, so you're able to dip it in there. If disposable towels are used, then the sanitizer bucket may not be needed since you would discard of the one-time only towels, the disposable towels. You shouldn't be reusing them for different surfaces or different uses. Keep in mind that some jurisdictions vary, so the local health department may have specific information or requirements regarding the use of spray bottles or sanitizer buckets. Another great question was, are all quaternary ammonium compounds effective against SARS-CoV-2, which is the virus that caused COVID-19, no matter who the manufacturer is? My answer is, there are many quaternary ammonium products that are effective against SARS-CoV-2. However, it is best to check the EPA website rather than assuming that all can be used. The good news is that there are a variety of products to choose from, and over 200 quaternary ammonium products are currently listed on the EPA's list, and more may be added as time goes on. For a little background information, there is a process to be approved and registered with the EPA, which includes testing of the products, which takes time. Chemical products have a variety of formulations, so it's important to refer to the manufacturer's instructions and labels to determine which one would be most suitable for what you're using it for. For example, some of the products on the EPA website are liquids and others are wipes. There are also different contact times, which vary from 1 minute to 10 minutes. So this will all play a role in which one you select. But again, check the EPA's website to determine if it is effective against SARS-CoV-2 before you proceed. Now I will turn it over to Chef Cindy.
Thanks, Lauren. So we had some more questions. So let's review changing and handling your face mask. So if your cloth face covering becomes wet, hard to breathe through, or over time, it doesn't fit your face snugly, then you need to change or replace that mask. If you are using a disposable mask, then you need to use one each day or replace during the workday again if it becomes torn or wet. And as far as handling, you're always going to take it off by the handles, the loops or ties. Be sure to wash your hands after you put it on, after you take it off. Also, another question we got, does whole fruit have to be wrapped? First, always check with your local health regulatory agency. But generally, if you are serving directly to the customer's tray, we would say unwrapped is fine. If there's going to be any handling before, such as, before the student eats it, such as teachers handing it out in the classroom, then it should be wrapped. And it's also going to depend on the type of whole fruit. For example, in the photograph here, the banana has a skin, which is going to provide a barrier of protection, but an apple does not. So they're going to be handled differently. In the photo, you see the apple is washed and wrapped, whereas the banana is ready to go with that wonderful, sweet message. Now, as far as those messages are concerned, they're awesome, but be sure that you're purchasing food grade markers. You're not whipping out your Sharpie. Lastly, employee illness. So let's go over this again. If you have a close contact with someone with a COVID-19 diagnosis, in the last 48 hours, then a 14-day quarantine is recommended, and you should check yourself for symptoms, check your temperature every 2 hours. And of course, if you're experiencing any symptoms, then please, please, please stay at home. If you are diagnosed with COVID-19, do not return to work until you have met the CDC's criteria to end your home isolation. Now, this is different than the 14 days for potential exposure that I just mentioned. This includes waiting at least 10 days from the day your symptoms first appeared and at least 3 days since you recovered. So how do we define recovery? It's no fever, and that's no fever without taking any fever-reducing drugs such as Tylenol, and an improvement in your respiratory symptoms such as cough. There's also the option of taking a COVID-19 test, and to return to work using the testing method, you will need 2 negative tests in a row, and they have to be at least 24 hours apart. You can't have a fever and then have an improvement in respiratory symptoms and go back to work. All right, so I'm going to turn it back over to Lauren because we have some more questions to answer.
Thank you, Chef Cindy. So moving on to other frequently asked questions. Well, milk was a huge topic of conversation, and we want to provide information to assist you with storing, handling, and transporting milk. The question is, can milk be sent home in a sack or bag as long as there's under 6 hours of transport? I don't know about you, but 6 hours is a very long time, and a lot can happen to food in that time. Milk should not be out of refrigeration for more than 2 hours, or 1 hour if the ambient temperature is more than 90 degrees Fahrenheit, which is typically during the summer. This includes time out of refrigeration prior to distribution. Therefore, the school should avoid having milk at room temperature prior to distribution for any time at all. Extended periods of time at warmer temperatures will cause milk to spoil more quickly than it would if it were kept cold. This may not be noticeable immediately, but the shelf life of the milk will likely be reduced. Shelf-stable milk, although it's more expensive, is an alternative that may be a good option is situations where schools are concerned about the feasibility of keeping milk out of refrigeration for less than 2 hours or 1 hour if it's more than 90 degrees Fahrenheit outside. Here are some practical tips. Do not keep milk out of refrigeration longer than it takes to be transported from the school to home. Encourage students and parents to travel home as soon as possible and to immediately place the milk in the refrigerator when they arrive at home. Milk should remain cold, which is 41 degrees or below, at the school up until the point where it's given to the student. And if refrigeration is not available, like during the outdoor pickup, you should use a cooler with ice or ice packs. You can also encourage customers to bring their own coolers or their cooler bags to transport the food home. I know I have a few at home that I love to use when I go to the grocery. Another option is to consider signage at the distribution site to educate everyone on the importance of refrigerated milk and other foods immediately after arriving home. You can also add instructions to the bag or box, like labeling and safe handling, which we covered earlier. And you can also provide verbal reminders. It always helps to jog people's memory about what they should do. You can also consider shelf-stable milk, as mentioned earlier, which only needs to be refrigerated once you open it. And this is specifically handy or useful for those situations where the milk will be out of the refrigerator for more than the recommended time frame. The next question we received was, is it best to use disposable paper products for the children to eat or regular dishes? If it is feasible, disposable food service items like utensils can be used and provided. This option may be more suitable for meals that are picked up and taken home or to go, which may be the common option in cases where school is virtual. In cases where children are at school or on site, then it may be more feasible to use non-disposable products or utensils since they're at the school where you can use a dishwasher or your 3-compartment sink. It is important to keep in mind that if you're using non-disposable utensil or dishes, you should handle them with gloves and make sure that you properly wash, rinse, and sanitize them between uses in your 3-compartment sink or your dishwasher. An additional note is to avoid or discourage the sharing of dishes and utensils between students and customers. Next slide. So Chef Cindy will take it away.
I'm back. Thanks, Lauren. As you can imagine, we had a lot of questions about the type of masks recommended. And we have photos here. So some of you are using cloth and some may be disposable. Just know that, that both are allowed. And the good news is the CDC just provided more information on the best options for face covering. So you might want to check that out. The clear plastic version you see in the photo, it's been reported to cause difficulty breathing, so this is not going to be ideal, even though it is nice to see your smile. After some testing, the second one you see up there in the photo with the mask with the valve has been shown to maybe not keep the virus out. So bottom line, select a multi-layer cloth mask that is breathable, it washes well, or you can choose to use a disposable version. But remember, both of them should fit snugly to your face and cover your nose and your mouth all the way down to your chin. Cleaning surfaces. So cleaning surfaces before meal service, we did receive several questions regarding cleaning desks prior to student dining. So as you can imagine, students should not be present while anyone is using a disinfectant. Okay? You can disinfect before the students arrive or at the end of the day, or again, anytime students are not going to be present. But you may use a sanitizer or an alcohol wipe just prior to mealtime with students in the classroom or the cafeteria. Okay, I'm going to turn it back over to Lauren, and we're going to take a look at some questions that you guys have typed in. Did we lose Lauren? Lauren, I think you're still on mute.
Sorry, I was muted. So someone asks about serving leftover foods. I do not currently know of any restrictions on reusing foods or serving leftover foods, so I do not think that should be a problem. However, we will keep you updated if we hear of any changes.
Someone's asking about a recommendation on a thermometer for taking temps. I did mention that it would be great for you guys to get the 1.5 millimeter thin tip digital thermometer. I would look for something that would, if you're operating a dish machine, I would find one that would be dish machine safe, but I wouldn't want to, give you any brand. So just look around.
The next question I would like to answer, are vented face coverings with vents or valves acceptable for food service staff? Well, the CDC does not recommend the use of those masks or face coverings with valves, so I would not advise you to use those simply because that valve essentially allows the virus to still be breathed out into the environment, and it could contribute to the spread of COVID-19. So whereas it may protect you, you may be releasing COVID-19 to other people. So no, I think you should stick with the double-line cloth mask or the disposable ones or any mask recommended by the CDC.
Someone has a question that they've asked about washing hands and handling fruit. It says if you wash your hands right before handing out the fruit, do they still need to be wrapped? So I would still avoid bare hand contact with ready to eat food in this situation. So you're washing your hands, you're putting your gloves on, and then you're handing the fruit directly to the student for consumption. I think that would be acceptable. It's just when there's going to be an in-between person that maybe can some cross contact. Just think about the cross contact between the person who's going to consume it and the person who's just handled it.
I also would like to piggyback on that question. And in general, ready-to-eat food is the best practice to wear gloves. You should not be handling ready-to-eat food without gloves. So that may be helpful. So another question was, do we need to temp shelf-stable milk before serving? Well, if you have not opened it, it's shelf stable, so no, you do not need to temp it. However, if it is open, which really should be at home, I would assume, because if you're at school and you have it unopened, then the child would drink it right away. So I don't think it would be necessary to temp it. But if you open it at home and you happen to have a thermometer, you just want to have peace of mind, then by all means you can temp it, but it's not required because it's shelf stable, meaning that it's safe out of refrigeration. So anything else? Let's see.
Lauren, do you want to take the question about how long milk sits out at room temperature? I know we had some guidance come up about that.
Okay, so as mentioned before, so the person said they do not have access to a cooler to put the milk in before serving. How long can it sit at an ambient temperature? Well, 2 hours if the temperature is under 90 degrees is the general recommendation. But if it is hot outside, which is 90 degrees Fahrenheit and above, then 1 hour is the general best time frame to stick with. So you really should not have milk sitting out any longer than 1 to 2 hours, depending on the temperature outside.
Someone else was asking about freezing milk to help keep grab-and-go meals cold. You can freeze your milk. I mean, you need to think about, is it going to be ready quality-wise for your students to consume? And inside that, I think about this. I'm talking out loud with you guys here. If you're in, let's say it's in a 3-compartment, even a foam 3-compartment, I'm questioning how well it would hold the other foods cold, unless you're talking about you're packing it in the bottom. Anyway, I think that one is something to think about, but I'm not sure you could trust that in order to document, say, food handling temperatures. But I like how you guys think.
Another great question is, what about oranges? Do they need to be wrapped? Well, oranges, similarly to bananas, have a skin, which is an extra layer of protection. So you may not need to wrap them because they need to be peeled before consumption if they have the skin on. However, if they're fresh cut oranges, those are considered a ready to eat food. So it may be helpful to wrap them just to be safe. So it depends on the form of the oranges. Are they peeled? Are they wrapped? Are they unpeeled and cut up? It all depends because that determines the best way to handle them. But if they're unpeeled oranges, then they're similar to banana where you may not need to wash them. All right. I think we have time for maybe like one more. Okay,
Oh, go ahead.
Sorry. Our whole school district uses shelf-stable milk due to transportation time, which is a great alternative, as I mentioned. Once you chill the shelf-stable milk, is it still good if it warms to room temperature again? It all depends on if you have opened that shelf-stable milk. Just for your understanding, usually there is a seal or a cap that does not allow oxygen to come inside. Once you have broken that seal and opened that milk, you should keep it refrigerated until the use by date. And we recommend sticking to that use by date past that point. So no, if you open the shelf-stable milk, then you need to refrigerate it continuously from there. Okay, I think we covered almost everything. Can the fruit be settled for self-service? Chef Cindy, do you have any thoughts on that?
We're not doing shear tables and things like that at this time. So to avoid cross contact, I would say best practice is no.
Mm-hmm. Yes, they do advise to do individual labeling and serving and everything separate for now until the CDC gives the okay to do buffets or salad bars or self-service stations. So right now, it's not a good practice. Oh, the questions are coming in. And we have time for about one more, so let's see. Can we wash and reuse heavy-duty disposable containers? Yes, as long as you wash, rinse, and sanitize them. I also want to add in another layer, which please make sure that these containers are food-grade containers, which are more durable, and they are designed to be washed, rinsed, and sanitized and reused multiple times. So as long as it's an approved food-grade container, then yes, you can wash and reuse it.
Hey, Lauren, I want to chime in just for a minute.
Mm-hmm.
If they're talking about their yogurt containers and ranch dressing containers, then that would be a no. I'm not sure what she's asking as I reread it.
Yes. We're not sure what kind of container, but if it's a reusable food grade container, then yes. If it is previously used for something else type of container, then generally that's a no-no, like Chef Cindy said. So, all right, so that's just about all the time we have for questions. Thank you for joining us today. Today's webinar, along with many others, will be available for on-demand viewing on the ICN's website. So if you know anyone who would love to know this information, feel free to share, or you yourself can rewatch it so that you can, take additional notes and tell a friend. So thank you so much, and happy Food Safety Month. And I wish you all a good day. I will turn it over to Janae.
Thank you so much, Chef Cindy and Lauren. Before we conclude today's webinar, I do have several announcements. So ICN, a new online course is available. We launched this course as a 1-hour online course. It It's an annual civil rights training for all entities that will be reimbursed with federal funding from the United States Department of Agriculture, Food and Nutrition Service to ensure compliance and enforcement of the prohibition against discrimination in all USDA nutrition programs. You can access this course under the Child Nutrition eLearning portal at the icn.org/elearning. Okay. All right, so our virtual instructor-led training sessions provided by ICN will be held beginning October 14th through December 17th. The topics will include food safety, CACFP, nutrition, train the trainer, and basic culinary math. The registration form and full schedule will be coming soon to the ICN website. And you can follow this information at www.theicn.org/field. All right, our child nutrition sharing site. So it's an online information center providing child nutrition programs with a means for sharing effective resources related to program operation. The CNSS aids the collection and sharing of state and local resources by providing a centralized place to store, organize, manage, and share knowledge and tools. We are turning to you, which are the boots on the ground, and we're asking for food safety resources to be submitted to the child nutrition sharing site. So you can visit the Child Nutrition Sharing site at www.theicn.org/CNSS and click on the Submit Resource tab, and you'll be able to submit your resources there. We do ask that you provide one resource per submission, and the amount of submissions, however, is unlimited. There is a designated tab for you to access helpful COVID-19 resources that have been submitted by operators throughout the country, and it has been approved by through the ICN's vetting process. We do encourage you to submit COVID-19 resources as well, and that is unlimited. All right, so just a final reminder that today's webinar has been recorded and it can be viewed on the ICN's website at www.theicn.org/star. So please remember to complete the evaluation at the end of this webinar. If you have any questions, please email us at helpdesk@theicn.org. We want to thank our presenters. Thank you so much for attending to everyone. And this concludes today's webinar. I hope you have a great day.